Hello and welcome to Mediscope. Today let's talk about the Canadian medical exam system. So if you have done your MBBS from Southeast Asia, from China, from Russia, Europe, any country, you need to give this Medical Council Canada exams. If you want to become a doctor, it's like making an intricate dish, and this dish requires some raw materials in appropriate quantity in appropriate steps. So let us discuss what is this and what is the route you're going to take for establishing yourself as a doctor in Canada. The first thing, if you have decided to work as a doctor in Canada, is to make a physicianapply.ca account. So you need to go to the website www.physiciansapply.ca and you make an online account, and from the account only you need to apply the test, and that's the only way you need to have a conversation with the Medical Council Canadian setup. So there are various exams. After you make the online account, you can apply for the exams. There are various exams. The exams are, you can apply for QE1, that is Medical Council Canada MCC QE1, Qualifying Examination 1, or you can give an OSCE exam, which is Objective Structural Clinical Exam conducted by the National Assessment Collaboration, or NAC. In short, we call it as a NAC/OSCE exam. So you can give an MCC, you can give a MCC QE1, or you can give a NAC/OSCE exam, or you can give MCC QE2. So these are various exams you need to give, and there is no special order that whether you're going to give a NAC/OSCE first or you will give a QE1 first. So out of these two exams, you give MCC QE, which is a theoretical exam which has CDM, clinical discussion modules, and and in that only you have the MCQ based structure. So in QE1 you can give it, or you give NAC/OSCE, whatever you want to give, theory or practical, you give it, and after this you will be eligible to apply for the residency match. So residency match is an altogether different ball game. You also need to give the IELTS with the academic not in the general category but in the academic IELTS, and your QE1 results and your NAC/OSCE results. Then you apply with the CAMS, that is the Canadian Residency Match System. So after the residency matching, then you apply for the residency and then you become a family physician. So NAC/OSCE is a special exam which is based on the practical skills of a doctor. These practical skills of a doctor would be requiring your soft skills, the way you handle a patient in terms of the history taking, physical examination, and your reviews about the diagnosis. So this NAC/OSCE would be basically testing the soft skills on how to be a much better doctor than just gaining knowledge and just gaining how the basic pathophysiology of every disease. So NAC/OSCE is where you will come to know about the ethical system of Canada, you will come to know about the public health laws in Canada, and you will come to know about the soft skills that are used in the Canadian medical setup. Whereas on the other hand, the QE1, the Qualifying Exam 1, that is the theoretical exam, it is based on 8 parameters. It is based on your assessment about health promotion, about assessment about acute, chronic diseases, or about the psychosocial behavior of the patient. And it will assess you based on your diagnosis capacity, about your management for every disease, how you communicate, and what is your behavior towards the patient or the healthcare system as a whole. So that's a very structured exam, QE1, Qualifying Exam 1, so which will require your theoretical knowledge. NAC/OSCE is a practical exam which will require your skills. So for NAC/OSCE, we are going to have a special preparation module under the Mediscope venture that we have started, and this NAC/OSCE module is going to help you definitely on how to approach for the case, how to do the physical exams, how to do the history taking, how to approach the patient in a very focused manner in an 8-minute interview. It's an 8-minute interview session in which you have to start from greeting and end towards your diagnosis. So how the structure has to be, that will be told in the Koski sessions that we are going to conduct. And we wish you all the very best in case you are applying for it. And you can just drop in anytime, give us a phone call, or you can mail us for more information that we can provide you about the Koski exams on how we are helping you in achieve your dreams. Thank you so much.